Hi, it's time I talked about a third aspect. The last two lectures covered how to take a clinical history and the importance of anatomy to the entire history. Today, what I take up is the importance of physiology. Now, representation of physiology is all about how the body functions, and when it is about how the body functions, it is much as what a patient will tell you when he visits you. His signs, his symptoms will be a reflection of an abnormal functioning. There are two perspectives to it. One is a rather technical one, and one a generalized one. If you talk of the generalized picture, it will be the same anywhere in the world, and it cannot be different. For that matter, it is a very common man's thing, and that is how you get to hear from your patient what is his problem. It could be like a sense of weakness. Now, that could symbolize a few things. A sense of headache, it could symbolize a few things. An abnormal growth, it could symbolize a few things. It is for you to understand what these few things could be, and from there coming down to something that this is it. Reflections to this are available in pathology reports or the lab reports that I talked about yesterday, which in most cases when it is an Ayurvedic doctor, he gets exposed to on a predisposition, since, as I said yesterday, it is all about pre-diagnosed cases. Now, at this point, it is important as a physician to understand that as a physician, your limits are not just to what the physical report is saying. It doesn't have to do with, say, a hemoglobin showing less, or a TLC or a DLC showing a different count, or a thyroid function showing abnormality. But it is about understanding the real cause and the implications. This is possible when you understand, and particularly this is with respect to metabolic disorders, that when you understand the working, the phenomena, how it works, and you are able to relate to it in a fashion that this will happen and this will not happen, this is the progression of it, you can then probably justify your treatments, the idea that you want to propagate in your treatment, and that will come down on paper in that reflection. Otherwise, if it is symptomatic, it will have a very different presentation. Now, in the Ayurvedic context, the physiology or the understanding of physiology is very different compared to modern medicine. The modern medicine physiology is very systemic. Alimentary canal and the endocrine system, the respiratory system, the circulatory system, and then it draws its advanced linkages into biochemistry and microbiology and genetics and cellular metabolism, and gets into a mesh. Ayurvedic biochemistry is rather very simplified. Simplified because it doesn't really talk about much of the systemic impact. It talks of a whole impact, which in certain places, in certain ways, has been shown also as how it could be limited to a certain part of the body or a certain zone. The physiology is entirely dependent on the balance of Tridosh physically and Tridosh mentally. To say Vat, Pitta and Kaph physically and Sattva, Raj, Tam mentally. anything around you, anything that you consume, or anything from within the body will cause an imbalance in these three doshas, internally or externally, environmentally or physical. These tridosh, or if one wants a biochemical exploration, the Panch Mahabhut and the concept of Atma in the form of energy, Ojas as critical energy or threshold energy, these concepts do not intertwine to make as complex a mesh if you look at it systemically, the modern science way. But they become a holistic function. So, if you say that there is an increase in Pitta, it is not just that it might reflect as, say, fever, but it also relates to other manifestations that it can show. The juxtaposition of this concept of Ayurveda onto the modern physiology on top of it, and then relating the pathology reports, the clinical history, and the environmental and other geographical findings that you relate or record during the course of history taking, they together form the basis of Ayurvedic diagnosis to suggest whether it is Vata, whether it is Pitta, whether it is Kapha, or whether it is a combination that is getting distorted. Now, here the understanding has to be a little more deeper, in the sense that if Vata, Pitta, Kapha are present all the time, that is what they constitute the body as, and one of them is deranged, does it not impact the others? It does. Now, when it does, that means there could be two approaches to it. Say you find that Pitta is aggravated. That means Vata and Kapha both may be depressed or altered. Say Kapha is slightly risen or Vata is slightly risen and Kapha is distorted, such that Kapha and Pitta Vata are balancing each other, but Pitta is just overshooting. So your approaches to diagnosis become two. You could recognize the same disorder as a Pitta aggravation, or you could recognize the same disorder as Kapha Vata depression. Now, and these two approaches, this freedom that Ayurveda gives you to look at the same disorder systemically, the same disorder in these two parallels, also allows you to have two different kinds of approaches to your diagnosis and treatment, depending on what the patient can afford in terms of physically being able to consume, his age group, his geography, his available resources, etc., etc., etc. Also, from the perspective of clinical history, it becomes important because you are able to push the idea or the understanding of the patient in a true direction. That is to say that you want to make the patient understand that he has a Pitta aggravation in the season of summers, and which is why it is reflecting as fever. He may not be ready to accept it because he would say that it's already extreme summers, I already feel the heat, what does this mean? Probably in that case you can make him understand by a Kapha Vata depression. Though that is not the language for the patient, you don't communicate it the same way, but that is one of the logics you can try to use. Similarly, there is another idea that works, and that is of putting these things in an organ specific understanding. So when you have an organ specific understanding, you can put these perspectives onto the same channel and help the person understand what it is, how it is, and how it works. All in all, if I have to say that bringing in the lecture 1, the lecture 2, the lecture 3 together, if you look at, you find, you record a history, you sequentialize it, you map it on the body, and then understand the mapping against the functions of the body, and together it comes as a consolidated single figure that works out. The next lecture will follow on prescription habits and prescription ideas, particularly, and that will definitely showcase more of telemedicine. Beyond that, there's the final lecture which will look to more or less summarize the whole thing. And I hope this series is going to help all who want to understand how telemedicine can be helpful or can be used in an Ayurvedic perspective. Thank you.